good afternoon, everyone. My name is Carly Janolis. I'm the science specialist at the Northwest Arkansas Education Services Cooperative.
And I'm Dustin Seaton, the gifted and talented specialist at the co-op as well.
At the Northwest Arkansas Education Co-op, we serve all of the public school districts in Benton, Madison, and Washington counties for Northwest Arkansas, but we're located in Farmington, Arkansas. Welcome to our last guest speaker, our 2 p.m. hour of the Real World Wednesday guest speaker series. We want to encourage you guys to use the chat or the Q&A feature at the bottom of your screen so that you can interact with our speaker and make connections with what you're learning in the classroom to how it relates in careers in the real world. There's no need to worry about unmuting or fixing your video. We're utilizing the Zoom webinar feature, so you are fine as you are, just being you wherever you are. So sit back, relax, and enjoy our guest speaker. We are joined this hour with Dr. Victoria Seaton. Dr. Victoria Seaton is a clinical pharmacy specialist in psychiatry at the U.S. Department of Veteran Affairs. A native of Van Buren, Arkansas, she graduated from the University of Ozarks in Clarksville, Arkansas in 2006 with a Bachelor of Science in Biology. She then went on to graduate from the University of Arkansas for Medical Sciences, or UAMS, with a Doctor of Pharmacy degree in May of 2010. Dr. Seaton was an assistant professor at the UAMS College of Pharmacy, Northwest Arkansas campus for 8 years before taking her current role at the VA. She is a board-certified psychiatric pharmacist with a demonstrated history of working in academia, clinical pharmacy, retail pharmacy, and in the pharmaceutical industry. Currently, her primary role is utilizing telemedicine to help veterans with their mental health needs, primarily in rural areas. Please join me in welcoming Dr. Victoria Seaton. That is a very impressive introduction, though.
It sounds like a lot whenever you're putting it all down on paper, but I promise you it was a lot of work over a course of a long time. So,
well, impressive nonetheless. And just to have, I love anytime we have women leading in the STEM fields. It's just
I
awesome.
agree.
All right. Well, Dustin, are you taking the odds and even still?
So what first got you interested in going into your profession at the VA?
So it was quite a bit of a progression. First of all, let's talk about how I got interested in sort of pharmacy. I think that sort of, segued my way into the profession and how I actually got into this position now. So basically, anything that you do, students, from here on out, I don't want to say is important, but take it on as an opportunity, to really gauge what you love and what you desire. And so it took me a little bit. I knew that I wanted to do something in the sciences or even math, mathematics. And so late in my junior year in undergraduate, I had a lot of information sort of being thrown my way. I pretty much said, I want to go into nursing or I want to become an MD. And PharmD was always there sort of in the back of my brain, just because the level of exposure I had was extremely minimal. But my grandparents knew a pharmacist pretty much, a family friend, and was like, you need to go into pharmacy. I'm like, oh, okay, whatever, but I didn't know a whole lot about pharmacy. It was pretty much like all I saw were people in Walgreens or Walmart or CVS sort of lick, stick, and count, and they're the people that you talk to whenever you need to have medications information. But that was the extent of the interaction. So I was like, yeah, whatever. It's sort of in the back of my brain, right? But then, whenever you get to college, you get more exposure in STEMs and in the sciences, science and mathematics. And I sort of, went into looking at what is it that I love the most and what is it that I could see myself doing. And I just went from there, it was always in the back of my mind. I went ahead and just tried it, talked to some people about pharmacy, and then ended up going to pharmacy school. So your parents know you best, you guys, like grandparents and parents know you best. I don't want to say I was destined for pharmacy, essentially because that was something that was always an option, but I never wanted to pick up that option because it's one of those things where if your parents tell you to do something, your grandparents tell you to do something, you're not going to really do it. So for me, I went ahead and took on that opportunity and never looked back. So, but to answer your question, Mr. Seaton, about how I got into the VA, the last year of, pharmacy school, you are able to apply for residency. And I was fortunate enough to be matched with Central Arkansas Veterans Healthcare Systems, which is who I work for currently. And that just kind of opened my eyes to the opportunities that pharmacists can do within the federal system and the federal government. And I'll go into detail about what I do here in a little bit, because I know that's probably a question that you may have, but that's sort of what opened the door for me to get into the VA.
I think that actually really kind of follows up into our next question of, you've pursued this career in the VA, having the opportunity to be exposed to those opportunities or what those jobs are. So then maybe just kind of telling us a little bit more about what it is that you do through that.
Absolutely. So once again, you're going to hear me say, take on every opportunity as they come. Every door is an opportunity for you to walk through. Don't slam it shut. Keep it in mind, okay? And that's what I really want to say to the students here. But at the same time, whenever I did my residency, I had it in the back of my mind that I really, really wanted to focus on endocrinology, diabetes management, et cetera. And part of that is because, Dustin, my husband, has diabetes, and that was something I was extremely passionate about. I'm sorry if I overshared that, but I think you're happy to tell everyone you do, and that's something that is a challenging responsibility every single day. But I had this residency program director that basically said, I want you to maybe think about psychiatry. And so I went into residency wanting to do one thing, and then very passionate about one thing, and then came out with a different passion, which are stark contrasts: endocrinology and diabetes and psychiatry, right? So you're looking at this and you're like, how in the world did you get into that? So that last year in my residency year, CAVHS really provided me the opportunity to grow that, and gave me the desire that I really wanted to sort of be in this sort of position. So after I graduated from residency, I went into an academic position. I was there for 8 years, where I was able to teach students, about psychiatry and addiction. So addiction is part of psychiatry. Okay. And then how I got into this position is pretty much, I went back to CAVHS to sort of, I felt like they grew me. So, they groomed me into becoming who I am. I wanted to go back and see what I could offer them. Okay. So in this position, and that's your question, right? Is like, what do I do in this position? I know this is a long way of getting around to this position, but I promise you I have a point. Is essentially, being able to see veterans on a daily basis out of my home. So welcome to my office. This is it. Through telemedicine, which is a very unique way of seeing veterans. I think it's growing, definitely in the COVID environment. There's lots of opportunities within telemedicine. And then I think, and I'll go into specific details on what I do. I think there's another question maybe on that. I'm not 100% sure, but essentially I see patients for their psychiatric issues in my home. I do appointments with them through Skype, a Zoom sort of venue. I have this fancy monitor, which actually has a camera attached to it that could be a doc reader, and it dials out. fancy equipment, but it also makes up for the fact that veterans can comfortably see me in their home without getting into sort of this COVID environment. We were practicing this even before COVID, so essentially it gives us another opportunity to check in on them in the comfort of their own home without them having to go to a clinic.
So we had a student question. How many years of education did you need to get to where you are to get a doctorate in pharmacy? And along the same lines, when you started out your journey, telemedicine probably wasn't on your radar, right?
Absolutely.
So,
Yeah.
so what I think is important for our students to understand is that even though they might have a mind for STEAM or some medical profession, it's an evolving career. Because I know my dad, when he was interested 40 years ago into going into pharmacy, they're like, oh, we don't need pharmacists. That's going to be automated, and how that's been a theme, but it's been evolving with that theme over time. So could you tell us a little bit more about how many years of education you need and the evolving pharmaceutical jobs of telemedicine?
Absolutely. This is going to sound daunting, but please let me tell you, a decade goes by so fast as you get older. For pharmacy, though, you can go to undergraduate for 2 years, get the prereqs, and then go to pharmacy school. So 6 years. But I went for a total of 8 years and then did an additional residency. So almost a decade, okay, like 9 years. Yeah, 9 years. And so you can do it as fast as 6 or extend it out as long as you want it. I know there are other colleagues of mine that have gone to do a residency and then they've done a fellowship afterwards. So, if you want to stay in school for forever, I always think that anybody that's in the STEM career is a student forever and always. I think that's something that is the most challenging part of this job, is always to be in the forefront, because you're in a STEM education. It is always evolving. Something that you thought was true probably 10 years ago may not be true anymore. Or something that you thought, wasn't true 10 years ago, it may be true now because of the, evolving of certain pieces of technology. So the second part of your question, is really stems on, the evolving of pharmacy. So I think I started this conversation with, whenever I met a pharmacist, they were behind a counter, sort of, filling your medications. They're the last person you saw in this journey of being sick. Okay, you're like, just give me the meds. I'm going home. I'm getting in bed, right? But the really neat thing is, every single job, I think, can probably be said, there's going to be a robot that's going to take over your job. And pharmacy heard it very loud and clear, very early on, probably in the 70s on. And I heard it even as a student, you're going to be off sleep one day. I remember exactly who said that to me, and I've tagged them in my brain, because, it's one of those things where it's like all the information that's in your brain is at the touch of my hand right now because of, certain drug programs. But let me tell you, don't listen to those types of people. If you're passionate about the STEM education and you are passionate about being a pharmacist like me, for example, that's something that you're going to do, and you're going to do it well. All right. So how it has evolved is pretty much, how every sort of job, I think, could evolve. So we're looking at, in pharmacy, for example, there's still automation. There's still robots doing certain jobs. But you know what? There's more medications out there. And something that computers cannot do for you is critically think. And that is something that I think is very important for anybody who's interested in science, anybody who's interested in really anything, is being able to critically think and being able to utilize the resources in front of you to make something happen.
I wish I had like a praise button or something,
Oh.
because that is so true. Oh my gosh.
Robots can't critically think.
No. Oh my God. And that's so true. And we're preparing kids for jobs that don't exist yet.
Right.
Because we have no clue what the world is going to be like in 10 years. But oh my gosh, they're going to have to be critical thinkers. We know that.
Yeah,
Oh, that was
definitely.
Awesome. So we had a question in our Q&A. It says, do you do anything that would maybe work with Concerta or maybe just any other kind of prescription drugs that are maybe targeted towards ADHD or
Absolutely. So ADHD is in psychiatry. It's a branch in psychiatry, just like schizophrenia, depression. So, let me say it loud and clear, the population I work with is a very difficult population. Difficult in the fact that, you're trying to understand the brain as a human who has a brain. So that's something that's very, I think, difficult to wrap your head around, and almost like an existential moment, when you're like, oh, I'm trying to, make this person's brain a little bit better, but how do I know that my brain isn't the one that needs to be a little better, right?
Ooh,
So whenever whenever there's somebody that's taking Concerta or ADHD, you may have talents elsewhere that others do not have. So I always tell my patients, don't label yourself as the disease, right? Don't say I'm depressed. Don't say have ADHD. You are your own unique individual, and you need to just highlight that, because there's not one person that's exactly the same. So yeah, thank you for that question.
Yeah, that's awesome.
So what does your typical day look like? I know you said you get to work telehealth or telemedicine from home. That's your office, but what does your typical day look like working with our veteran population?
Yeah, so, oh, by the way, I meant to say this at the very beginning of this presentation. Happy Veterans Day.
Yay.
So I thought it was really ironic that, veteran employees get off Veterans Day. But, it's provided me the opportunity to speak about them. I do serve veterans first and foremost. And so a typical day of what it looks like for me is, let me just start out with like who I serve, and then maybe that will sort of segue into what my day looks like. I'm going to share something really quick. There we go. Can you see that?
Mm-hmm.
All right. So when I say I'm serving veterans, I'm serving patients, you can't really tell how many patients, who I serve, whatever. I thought this slide could sort of show the area I serve. So although I focus on Arkansas, I actually am a Vision 16 clinical resource hub pharmacist. Now that's a lot of words to say. I serve all veterans in Vision 16, and Vision 16 goes as far as Joplin, all the way as far west as Houston, Pensacola, Biloxi, New Orleans. And this area in itself has 1.4 million veterans, and more than 450,000 veterans receive care at the 8 large VAMCs and 61 outpatient sites. Okay, so that's a lot of veterans. We are one of the largest in the sort of the nation when it comes to serving this many veterans. So that is why we have telemedicine, is because the focus of my position is to reach out to veterans who are in rural areas. So yeah, I'm not looking at the screen, I'm looking at here. So I'm so sorry. That is a challenging part of my job, by the way. When you're telemedicine, you're trying to speak with them eye to eye and you keep looking down. We're told to just keep on looking at them eye to eye, which is really difficult, I think. But anyway, my typical day, whenever I'm deployed to any of these locations, is to sort of have a team huddle. We have a team huddle once a week. We talk about the patients that are coming in on our panel. And normally I could work in 2 different sets. So one, I work with primary care, where mental health might not be the focus, but the patient comes in and says, I'm depressed, or I have some anxiety, and that's why I'm not sleeping. Well, this is first case episode. This is something that's not as severe. the physician would counsel me or consult me and ask me to see this patient and to take care of this patient. Okay. And then there's another section of my job where I work in specialty mental health, where the patients are a little more severe. Okay. So those patients are the ones that actually was discharged from the hospital maybe, and they need follow-up. They're bipolar or schizophrenic. Those are sort of, uncontrolled diseases where they come in and see me. So there's two different sections. So depending on where I deploy, and I'm very generic about this because there's so many different places I could be deployed in Business 16 for different services. Primarily I have a team huddle. I see my patients throughout the day, and I could see anywhere between 4 to 8 patients in a day, or sometimes more if they overbook and squeeze in patients. And then at the end of the day, normally I'm frantically trying to get finished with notes. Okay. So we're documenting like crazy, making sure that I'm prescribing all the right medications and sending it out to them, because in psychiatry, sometimes it is an emergent need, and I'm contacting the right people to keep eyes on them, to make sure they're getting their medications and making sure they're having adequate follow-up with therapy. So I know it's very generic, but that's what it basically boils down to.
And that's
great.
It's a great lead way to another question we had from a student. What are the most common things that you deal with as a telehealth pharmaceutical professional? Is it depression, bipolar, ADHD, especially in our veteran population?
Yeah, so, when we're working with the veteran population, they are extremely unique in the fact that, they have seen things that we probably will never see. Definitely the ones that have been deployed elsewhere. So when I have to pinpoint one disease state, I would have to probably end up shouting at 2 that I see most often, because they do go hand in hand. It is depression, it is anxiety. Sometimes patients come in and they present more with their symptoms of anxiety, and it's probably more depression, or vice versa. A specific type of anxiety that we see most often in our veteran population is PTSD. And that in itself can, have mimic symptoms of depression to some extent, and need further therapy and follow up. So yeah, those I would say if I had to really pick out 1 or 2 disease states, it would be depression and anxiety.
Okay. What do you think is the most challenging part of your job? And then also, in addition to that, maybe the most rewarding part of your job?
Okay. Well, let me think here.
I'll put you on the spot.
Yeah, no, I'm just trying to figure out how to say this without discouraging STEM students. Personally, I think the most challenging and rewarding, I think, sort of go hand in hand. It's all in the way how you look at it, right? So you can think of it negatively and be like, man, that was challenging. Or you can think of it more positively and be like, you know what, but it was rewarding. So it sort of goes hand in hand. So whenever I think of what is the most challenging and rewarding part of my job, that is the patient population that I work with. And I think I alluded to that. There is a high burnout rate in medical professions in general. But, in psychiatry, I haven't ever seen objective information. I think I need to look at that before I actually say this is it, but, and be very factual about it. But from me, just looking at it, the providers I work with, it's hard to continue on for an extended period of time, because I think it takes an emotional toll on you as well. So you've got to be very good and cognizant of, what, I'm taking this emotional jacket off and I'm now at home, I'm putting on a different jacket, right? So so that is the most challenging part, I think, of my job, but also the most rewarding in the fact that these patients when you're seeing them for the first time are the most, sometimes it takes a little while to get them to open up, but it's a raw experience in the fact that they are telling you what they are feeling inside, and they're coming to you for help. Because I don't know if you've ever been in a position where you just don't want to tell people your feelings. That doesn't come sort of naturally, and it's you feel it, but you can't really put it into words, right? So it's one of those things where when they're coming to see you, they're in dire need of somebody to get them help, right? Or to find something. If I can't find a way to help them, then I will try my darnest, to find someone else who could. And so essentially, I think that is the most challenging but rewarding, because I do get to see them up for follow-up. And over the course of the time that I see them, they're a different person, because, I'm a pharmacist. I believe in medications, but I don't believe that medications is the end all be all, especially mental health. I think, people need to talk to each other, feel the emotions, and actually seek help when even before help is needed. So.
Oh, that would be hard, because I think it would be so easy to take on all of the pain that other people feel. I mean,
Absolutely.
I would be a terrible pharmacist. I mean, I would probably just cry with them. Like, I
No.
know that's terrible.
Yeah, no. So there are moments where I'm like, you know what, this stinks, and you get really emotionally wrapped into it. But at the same time, you have to have good mental well-being on yourself as an individual to be able to work on that. You've got to put sort of your mental well-being first before you could help others. So help yourself before you can help others, right? So that's something I do keep in check, just because you can definitely have a very emotional roller coaster. You can actually have burnout, stress, all of that stuff when it comes to working in psychiatry. But one thing that students might think, is what might be challenging, what rewarding is, in my field, in pharmacy in general, is the everlasting learning for an individual in STEM education. And I think I alluded to that previously whenever I said, you always have to, you will always be obsolete. So I had a professor that says, the day you graduate, you will be obsolete. So to find a way for you not to be obsolete is something that is extremely important. The day in May when summer comes around, you're like, yay, 7th grade or 8th grade or 9th grade is over. Well, you know what? You are obsolete at that very moment. So continue to learn, and continue to have that desire to learn, because once that stops, I think you're really in trouble.
So you talked about just with medications, that they're not the end all be all, that there's more that goes into that. So what about if people are taking, we had a question in the chat, and it was relating to Concerta, but maybe just any kind of drug that would be altering, whether it's your hormone levels or dopamine levels. What happens if you don't take it? So if you're prescribed it and then you stop taking it without proper.
Right. So don't do that. The pharmacist in me, please don't do that without consulting a healthcare professional. And the person that you could probably seek help, very first, person that you could come to and immediately would be that pharmacist that you get that prescription from. So whether or not you go to CVS or an independent pharmacy or whatever, you have a question like that, just go, and they could find the resources to help you get off of it safely. The thing is, I would always say don't do that, just because anything that's mind altering, something that definitely works in serotonin, norepinephrine, dopamine, something is being stopped abruptly. Think about that. If you put a brick wall right in front of a coasting car, you're going to have a huge car wreck, right? Sort of the same thing in your brain is like, if you stop the medications abruptly, just have that sort of visualization, because there's now neurons that are not being connected appropriately, that are not communicating appropriately. And so when that happens, I can't predict I mean, I can predict, but I predict for an individual, for my patients. Once I know their medication history, their problem list, et cetera, there may be other underlying conditions that will suffer from it. If somebody has like a cardiovascular problem and you abruptly stop something, you know, it's just not a good idea. I would definitely counsel to seek your nearest healthcare provider before you stop any sort of medications or before you start. Because I think there's so many medications accessible. You think that you can take, you know, someone else's medication and be okay. That's illegal. So just know, you know, that that is something, even if that's your best friend in the whole wide world, just know that that is still illegal because that medication is not prescribed to you. So anyway.
So I've known you a long time. What would you tell students, because we have a lot of junior high and high school students here and middle school students, what would you tell them that you wish you knew at their age, at not the end of your journey, but now you're a esteemed professional? What words of wisdom would you convey to them on things that if they're interested in going into a STEM profession?
Okay. I like how you ended it with, if you're going into a STEM profession, because if I would have known in junior high that I was going to marry you, I'm just kidding. I'm just kidding.
Win-win.
Yes.
Yes. No. Anyway, let me see. Let me get back on track here. What do I wish I would, what in junior high? Okay. Let me see. So pretty much I derailed myself. So I'm the one that's at fault here. I derailed my mind here. Okay. There are many possibilities in STEM education. Okay. So don't lock into one right now and say, that's exactly what I'm going to do. Okay. And the reason why I say that is because you may think a pharmacist does one thing, but they can do 100 of other things. Okay. Remember how I said, oh, I thought a pharmacist was lick, stick, and count, whatever, right? For me, like that's all I thought. And I've worked in retail in an independent pharmacy. I worked in academia for 8 years teaching students. So I used to describe it as, and I still do, I'm a pharmacist that doesn't even touch a pill, you know, so which is very unique and an oxymoron in itself. And then I did a year in industry, and then now I'm here. So, you know, the way you portray a certain job may not be as fancy as you think it might be. It might be super boring. You know, but the possibilities are endless with a STEM education. And so I think that I wish I wouldn't have just said, I'm going to be this, you know, like at the time. So I think, you know, it's cliche, the world is your oyster. Take on every single opportunity. And if you don't and decide to say no, be okay with that. Don't beat yourself up because that opportunity is no longer there and Sally Ann took it on and now you feel like you missed the entire boat. Right? Don't be okay with whatever decisions you make, but make sure that every door and window of opportunity is open, so that you can slam it shut if you feel like I've done that. All right, let's shut it. You know, let's shut it down. But with the STEM education, I think there are so many endless possibilities. But just know that because you know that critical thinking skill is so important. Know that 4 years of undergraduate may not be enough, you know, to be where you need to be. So just be that, you know, continuous learner. So 4 years of education and undergraduate, just, I see that a lot is, you know, you're a bio or chemistry major and you've done 4 years and now what? If you're a science major, let's just be real here, you may have to go on further. Okay. And that's fine because the tools that you have, being a critical thinker and being, you having the passion for STEM education will keep you going for a little while. All right. So just know that you'll go on a little bit longer in schooling than, you know, to get where exactly you want to be before anything else. So, yeah.
That's awesome.
Was
And
that-
we've heard that.
Am I long-winded here?
No, you're great.
Okay.
That's great. That's why we're asking. But that's something that we've heard from, I mean, all of our interviewees today is just there's such a big range of opportunities out there, and you've got to try them all, and you've got to explore it, because there's just, we just don't always know what's out there, what kind of jobs are available,
Exactly.
things you've never even heard of, but that you may be excellent for and love. So
Mhm.
I love that. How has COVID-19, this world of COVID, affected your profession, or has it affected it?
Well, it hasn't really affected me as much. I mean, as I've gotten older, I've become more of a homebody. And it's one of those things where I enjoy working from home and being at home. I have the insight enough to be able to say, I can do that and keep myself on task and be okay. Some cannot do that. And so, just know that, and I guess I'm more focused on the environment than the COVID itself. That you work in is very important. For me, it allows me to be at home, and I've practiced this even before COVID. I don't see them face to face, and there are definitely challenges to that. I think I think I alluded to it. One of the hardest parts is, being able to look him eye to eye and not being able to do it because, there's a camera right there. And that's something that I tell my veterans. I'm like, it may not look like I'm looking at you eyeball to eyeball, but I am. So, just know, and I'll look up each time just so that there's a different level of connection. But being able to connect via Zoom and, what we call CBT and VBC is very difficult. But COVID in general hasn't really affected the way I work and function. I just have to make it more of an effort to try to stay connected to the veterans, because it is different for them, right? So I have to not only, if they don't pick up on Zoom, I'll just reference it to Zoom, but we call it CBT and VBC. They don't pick up, then what I'm going to have to do is call them on the phone, be like, hey, Mr. So-and-so, did you remember we had an appointment? So I think that is, very different for them. So I have to be mindful that this COVID environment is very different. The telemedicine is very different for them.
Do you see it like with your older patients?
Mhm.
Yeah, and not to be stereotypical, I'm just thinking of like my grandparents would have no idea how to work
No,
any
absolutely.
kind of anything. I mean, my grandma can barely work her cell phone.
Yeah.
So, I mean, has that been a barrier with a lot of your patients, or do you guys have things in place to help those?
So yeah, that's a good point. So the VA is extremely creative at utilizing all of their resources appropriately. The thing is, you're absolutely right. The older patient population, has a little difficulty getting there, but we try to make it as simple as possible. Like essentially, we give them an iPad and we put one icon on it. I'm like, okay, Mr. So-and-so, just push that button when it comes time to do it,
Yeah.
and so they do. I find it a little more challenging on the phone, because at least on VBC I could like chat if they can't hear me. So it's like, hi, Mr. So-and-so, how are you doing? Sweetheart, I can't hear you,
Yeah.
okay, well, let me get on here, so I feel like that, whatever piece of technology you're using, I think it's challenging for different populations. I think the more challenging part is not in our older patient population, but actually utilizing internet. So I've had patients where I've instructed to go into certain location that has free Wi-Fi, to do that. So I think we're trying to navigate that, because now we're such a, technological, like heavy type of industry. We're turning into that, but we don't have the basic needs for everyone across the country, which, and I work in for the rural patient population, where they may not have a car to go to the nearest McDonald's that has a free Wi-Fi,
Right.
So we're trying to navigate that. It's always challenging. I do phone appointments, but that's definitely not really. I'd rather see them face to face because it is psychiatry, So you're like, well, I want to see you,
Yeah, of course.
So we're coming up to the end of our presentation, and we want to ask you, do you have any fun stories or anecdotes you'd like to share from your time in a STEAM profession?
So I'll be honest, I am not the fun one in the relationship. I think Mr. Seaton has that in the bag.
This is recorded, by the way.
About his funness. He has to drag me out of the anti-fun hole that I live sometimes. And so I don't have a whole lot of fun. I bet my students do. I have students that would say, like, remember Mr. So-and-so? And I'm like, I really don't, because I have a horrible memory. But you do have those patients that you see them at the beginning, you're like, wow, that's hard, right?
Yeah.
And then you see them at the end and you're like, well, fist bump, what in the world? How's it going? And so I don't think that that's quite as fun, but it's more rewarding. I will always also have a plug with any sort of presentation that I do. And that is, psychiatry. For me, I try to keep it very lighthearted at times. Case scenario 2 seconds ago. But, the thing is, it is very heavy. It's something that people don't talk about. And the word that people hush and not want to talk about is suicide and depression. And so I would encourage, and this is just since we're finishing up a little bit early, I thought that I would give a plug to the, sort of the suicide hotline. Talk to somebody, talk to your counselors, your friends, and friends take it seriously, take it to someone else, but preemptively say, you're telling me this and I see that, you're putting your life at harm and I care about you. So is there let's go together and talk to somebody. All right. So always be mindful that someone's life is worth more than an embarrassment or than tattletelling or than exposing a real sort of secret. Okay. Because this is something that we shouldn't keep secret, which is, depression and suicide and anxiety. So yeah, thank you, Mr. Seaton, the Suicide Prevention Lifeline. So that's like 1-800-273-TALK is a suicide, that's how we remember it. But once again, if that's too much for you, there's also the Arkansas crisis hotline. I don't have the phone number in front of me, but there is a text modality where because we're all texting now. If you want help and need to seek help, I bet every one of your students are more tech savvy than I am. They could probably Google it, find the Arkansas, crisis line and text them also. So.
Yeah, because I was just going to piggyback off of that, because as a medical professional, someone's mental health state, and I didn't know if you've ever been out in public and you're not allowed to say, oh, I know this, but if someone is suicidal or homicidal or have other bipolar, schizophrenia tendencies, what's your reaction? What's your go-to as a recommendation for medical profession?
Or an individual, like a friend to friend, or a friend,
or if you as a licensed healthcare professional, if you were to see somebody that their diagnoses as something severe, what would your reaction be if you were to see them out in a normal setting in society?
I would say, so this is where it's a little difficult to really know what to do, because do you call the police? Do you call, who is the most accessible to this patient? And I know that, our police department, they're getting, they have been trained and adequately trained on how to do some of these things. I'm not as familiar as what their curriculum is. You know, but if you see someone that has had that definitely something is a little off, wrong, and you see them, try to get them some help somehow. You know, don't engage or anything like that, because your safety is important as well. But also try to find help, and part of that help might be, you know, the first responders, you know, and so getting that person appropriate help. And that's definitely a severe case. If you see somebody, you know, out with something going on, and you know that it's not appropriate behavior for the venue or environment, that's something that I think you can get help. But when it comes down to, you know, conversationally, I feel like hurting myself, I feel like cutting myself, I feel like killing myself, my parents aren't listening, you know, and you know, the only way I could get them to listen is by hurting myself, you know, that's when those situations, I think, happen way more often than the severe you know, patients that you may or may not see. So, you know, just kind of segueing back to that message is to get help, you know, whether or not it is a mild case, or thinking of hurting themselves, or somebody who may be out and having lots of issues at that time. So, yeah.
Excellent. Well, thank you for taking your day off
Mhm.
for Veterans Day to talk with us and our students today. Thank you all to the students and teachers that signed in and tuned in. And for those that will be watching the later recordings, thank you all for finishing today's video. But appreciate Carly for co-moderating with me today. And
Yeah, it's fun.
we'll see you all later. Hope you have a fun rest of the Northwest Arkansas STEAM Week Challenge.
Yeah. Bye, guys.
Bye.